So good morning and welcome. And thank you for joining our conference on HOPWA-CV implementation. My name is Crystal Pope. I'm with Collaborative Solutions, who is the host for this session. Christine Campbell and I will be your presenters today, and we're joined by Kate Riddell, the manager for HIV/AIDS Housing and Health at Collaborative Solutions, and Emily Fishbein, program associate, who will be managing questions from participants that we hope to take at the end of the session. We're also very pleased to be joined by HUD staff from the Office of HIV/AIDS Housing, OHH, including Rita Harcrow, Director, and Amy Palalonis, Senior Program Specialist. As most of you know, we're approximately 16 months into the implementation of HOPWA-CV activities made possible in great part by the CARES Act funding. Our audience here includes HOPWA grantees, project sponsors, field office specialists, and other stakeholders we know. Some of you have a high degree of knowledge about the CARES Act as it relates to HOPWA, and others we expect have more practical experience in carrying out specific HOPWA activities. So this presentation is intended as an overview of HOPWA-CV to date, because it's been going on for a while, including links back to previous webinars and guidance to ensure that you can all access the information you need to continue planning and implementation of HOPWA activities to ensure that our households remain safe and stably housed. We especially want to keep in mind that the pandemic is a changing and dynamic situation in most of our communities. So it's very important for you to stay dynamic in your own planning and be able to make adjustments going forward. So before we jump into the details of our presentation, I'd like to turn it over to Rita Harcrow from OHH for her comments and opening.
Thanks, Crystal. I just wanted to echo your welcome for everyone. I appreciate your attendance today. It's been a challenging year and a half for all of us, and we are grateful for the work that you all have been carrying out on the ground. Hopefully this conference, this session will help us start to think through the next steps as we begin to move forward, especially for folks that have still have money left on the table, if it's time to start thinking about what to do, how to serve, how to assess. So again, welcome, looking forward to hearing from you all and hearing your questions today during the session.
Thank you very much, Rita. As a reminder, submit your questions. This is not quite right about where it is, but as the intro explained, at the bottom of your screen using the Q&A box will allow you to submit questions, and we encourage you to do that throughout the presentation. We will do our best to answer questions as we go along and at the end, time permitting. So at this point, I want to turn it over to Christine Campbell.
Thank you, Crystal. And again, I echo everyone's welcome. We're excited to be doing this presentation for you today. Where we thought we'd begin is with a background and summary of what was available in terms of funding and waivers and how to really frame some of our thinking around the CARES Act funding. So as you know, CARES Act was signed into law on March 27th in response to the coronavirus pandemic. What we wanted to do was provide substantial resources to HOPWA grantees to prevent, prepare, and respond to the coronavirus. The funding was intended to be flexible and be able to be responsive to communities' needs. The expectation was that there would be some good planning, as good a planning as we can do in a epidemic situation, to be able to really meet the needs of our communities. The CARES Act provided approximately $65 million in supplemental funding for HOPWA in 2020. 53.7 million was allocated to formula grantees, 10 million was allotted to competitive grantees, and this was a one-time award that was to be used directly in response to the COVID-19 crisis. HOPWA-CARES Act funding was distributed to 140 formula grantees in eligible metropolitan statistical areas and states, and the 2020 formula metrics were applied to all of these allocations. So there were multiple funding streams that our HOPWA grantees could use to be able to prevent, prepare, and respond to COVID-19. So for the HOPWA formula grantees, there were 3 potential HOPWA funding streams that could be used. The first was the CARES Act funding that was allocated in a formula. The second was the 2020 funds designated for COVID-19. Grantees were allowed to designate a portion of their 2020 funds specifically for COVID-19. And the third part was the regular formula HOPWA awards. For competitive HOPWA grantees, there was one funding stream designated specifically for COVID-19 activities, and that was the CARES Act funding. The competitive grantees were also encouraged to continue to implement their current grants as approved and make use of any waivers that applied for this funding. So there were HOPWA CARES Act eligible activities. These provisions are things that were thought through when planning how to use the CARES Act grant funds, or when adapting your funding strategy based on evolving local needs. So CARES Act funds were granted as additional funding to maintain operations, for rental assistance, supportive services, and other necessary actions in order to prevent, prepare, and respond to COVID-19 beginning in 2020. Funds would be used to provide any eligible HOPWA activities, and grantees were encouraged to use these funds consistent with their community plan and consistent with their community needs. In order to protect people living with HIV, funds could be used to self-isolate, quarantine, and for other, not only for themselves, but for household members not living with HIV and AIDS. So here we're looking at some of the CARES Act eligible activities. Some of these are activities that had not been allowed in the past, and in some cases these are activities you might not consider if they were not for the serious challenges posed by COVID-19, especially for people living with HIV and AIDS who are especially vulnerable to this infection. The things that were considered were things like hotels and motel stays or other locations to quarantine HOPWA eligible individuals or their family members, transportation services, accessing essential services and supplies such as food, water, medications, medical care and information, nutrition services, education for households to reduce the risk of getting sick or spreading COVID, and costs related to infection control measures such as cleaning and disinfectant supplies, gloves, and other safety-related supplies for staff and assisted households. So, knowing the challenges in implementing these funding, HOPWA put in place several waivers and notices to allow for us to be able to effectively serve our communities. So there was what was called Mega Waiver 1 and Mega Waiver 2. The first Mega Waiver really focused on the CARES Act funding and were things like self-certification of income and credible information on HIV and showing real documentation flexibility. There was a waiver to the rent standard for TBRA, which allows for rent standard increases. There were property standards for TBRA, which would allow for delay in initial inspections or to conduct those inspections remotely. There was the waiver for public space and security, which allowed for the use of alternative spaces for housing and shelter. Mega Waiver 2, which was released on May 22nd of 2020, actually extended those waivers to all rental assistance. So the rent standard, for instance, for HOPWA rental assistance was extended to all rental assistance. Property standards were extended to all HOPWA rental assistance. STRMU limits up to 12 months of STRMU in a 12-month period, which was to be used on a case-by-case basis, and short-term supported housing limits were extended up to 120 days versus the 100 versus 60 days in a 6-month period. So as you can see from these waivers, what we were trying to do was make sure that as much flexibility was allowed to be able to provide services to people living with HIV in a way that most met their needs. Please note that there are links to both of these waivers in this presentation, and the slides for this presentation will be made available after the conference. There was a notice that was also released by the Office of HIV/AIDS Housing that further explain the implementation of HOPWA-CARES Act and requirements. This slide has a link to that notice. So some of those elements included the administrative costs were increased to 6% and increased for grantees and 10% for project sponsor. STRMU limits, STRMU may be provided with CARES Act funding for up to 24 months. There was some clarification on hotel and motel stays. There was some additional information on HOPWA supportive services, including those specifically noted in the CARES Act, such as transportation, accessing essential services and supplies, food and nutrition, and education for COVID-19 risks and infection controls. So this notice provided some details on how you could implement these pieces and improve your ability to provide services to people living with HIV. FY20 allocations for COVID-19s, noting that grantees may designate a portion of their FY20 funds in their annual action plan for COVID-19 response. And then there was some discussion around how grantees must prevent for duplication of benefits. Later in this conference, there is a session specifically on duplication of benefits. There was a lot of resources introduced into many communities from many different funding streams. And it was imperative that grantees looked at those multiple funding streams and allowed for the maximum use without duplicating those benefits if you were using those multiple streams within communities. So as the epidemic progressed, there was a need to extend the waivers. So to date, HUD has issued 2 waiver extensions that allow HOPWA grantees and project sponsors to extend the use of certain options beyond their original dates. The first waiver extension was extended. This mega waiver provided time extensions for activity waivers, including those connected to HOPWA, to March 31st. The second extension extended these activities till June 30th of 2021. What we've done is we've put together.
I'm sorry, those were actually the dates that they were issued. And
Gotcha.
right.
All right. So we've actually put together a chart to kind of show the progression of the waivers and where some of these extensions are as of right now. So for instance, self-certification of income and credible info on HIV status. The end date is now set at September 30th of 2021. The FMR standard for TBRA, the end was 1 year, and that was through March 30th of 2021. the HOPWA FMR standard for all rental, because as you, if you remember, the second waiver extended all standards for all rental assistance is now extended through December 31st of 2021. The property standards for all rental assistance has now been extended through September 30th of 2021. The HOPWA space and security is undefined, but is applicable while quarantining is necessary. And finally, the time limits for STRMU has been extended through December 31st, 2021. So as you can see, there are certain things that end at the end of September, with our self-certification and property standards. There are certain things that end at the end of December, which are the FMR rent standard and the time limits for STRMU. And there is one waiver provision with no specific end date, and that's around space and security. Please note that the provision has an end date versus being tied to local health conditions, or the provision around self-certification and income and credible information on HIV status. It has no end date as opposed to being tied to the local health conditions. I mean, now has an end date of September 30th, excuse me. So again, this slide really is talking about how we need to start planning for these potential end dates. Crystal, when you think about planning for these end dates, what are some of the things that come to mind for you and some of the recommendations or things that you would recommend that grantees begin thinking about?
Well, now is the right time to think about it. And with the second extension, I think it has caused some confusion. And so we really encourage everybody to take a look at the language in the both the first and second extension to know exactly what your target dates are. So there's some things that people can start doing right now, especially obtaining source documentation on HIV status and income. This now requires that your source documentation must be obtained by 9/30/21, which is something that will be coming up very quickly. So that is something to look at. Also looking forward to transitioning from virtual, if you're doing that, to on-site initial inspections. And physically re-inspecting those units that were previously inspected virtually. That has been extended. The ability to do virtual inspections has been extended to 9/30/21. But it also, if you read it carefully, it requires that all physical re-inspections be completed and documented in your records by the end of the year. And I think the other thing that is coming up a lot, Christine, is questions about returning to the established rent standard. There have been a lot of questions about that. And so I think, we can answer anybody's questions that they have about that today, but I will say that we are working with OHH on the more definitive guidance that they will have on how to on different ways that programs can work to make that transition and not have a negative impact on both the program and your HOPWA eligible households.
So like Crystal was saying, stay tuned for more information. TA will be available as we start moving forward and doing this planning to as some of these deadlines come closer. So there have been some additional HOPWA program flexibilities that the Office of HIV/AIDS housing approved. Some of these include things like gift cards for food and gas are allowed, car repairs, annual unit re-inspections may be delayed or remote, but like Crystal just talked about, that does have some end dates, so we need to prepare for that. Hotel and motel room damage was allowed to be used with CARES Act funding and FY20 funds only. PHP and STRMU combination, at least one activity may be CARES Act funding. So we've provided some fact sheets and some information in these links. So please, if you need more information on how these activities and flexibilities can be applied, please check them out. There's one on HOPWA COVID-19 activity and cost eligibility. There's one on getting the facts on HOPWA-CV response, and one on the HOPWA COVID-19 webinars. Many of you may remember there's been a series of webinars that provides a lot of details on how all of the HOPWA-CV activities can be effectively implemented in your community.
Great,
Crystal, I'm going to toss it to you on some overviews and updates on some of these specific activities.
Okay, thank you very much. So next, we're going to provide a brief overview of what we consider some key HOPWA-CV program elements. Remember that all HOPWA activities may be carried out using CARES Act funding to extend what you're able to do, and with regular funding to address pandemic issues. But these are the elements that are generally most used by grantees. Each has certain new flexibilities, and generally the activities about which people have the most implementation questions. Short-term rent, mortgage, and utility assistance, STRMU, as you know, has been expanded through the CARES Act and the HUD waivers to enable programs to quickly respond to the emergency housing needs of HOPWA-eligible households in order to help both renters and homeowners to avoid housing instability and the threat of homelessness. Virtually all HOPWA programs have seen, and many are still seeing, significant increases in the number of HOPWA households that cannot keep up with rent, mortgage, and utility payments. There are lots of reasons for that, including people have been impacted and affected by COVID in a variety of ways, including contracting the virus, loss or downturn of jobs, fear of infection, fear of going out, and all of those things. The expansion and increased flexibility of STRMU is intended to help keep people in their homes and avoid instability and the threat of homelessness. There's really nothing that was made simple about how to deal with all of the different things that are allowed under STRMU during this time and CARES Act. So, you know, there is a lot of information out there that we encourage people to access. But just to review briefly, there are three basic categories of STRMU, or streams of STRMU, however you want to think about it. The first is your existing STRMU program, if you have one that's funded through regular HOPWA allocations. And as you know, in that program, a client can receive up to 21 weeks of assistance in a 52-week period. Or some programs have caps in place that allow fewer weeks or cap on the total amount that can be received. All of the normal STRMU rules continue to apply related to eligibility, legal residency, and need. The second is that same existing STRMU program in which you're utilizing the 52220 waiver option that can be applied on an individual household basis. Approved households using that waiver can receive up to 12 months of STRMU assistance in the 12-month period. And that one, I would note, has been extended by the latest waiver extension through 12/31/21 through the end of this year, based on that waiver. And the third is STRMU that's provided through CARES Act, using CARES Act funding or using FY20 funds that the grantee has designated in their annual action plan for COVID-19 response. Remember that all CARES Act funding has to be depleted before the FY20 set-aside funds are used. In this CARES Act STRMU program, a client household may receive up to 24 months of STRMU assistance. The distinction between the STRMU categories and how to implement them seamlessly is not always simple. So again, we strongly encourage all staff, both administrative and direct program staff, to review the resources listed here in order to better understand the nuances and the requirements and make sure that you are documenting things correctly. The STRMU funding options guide, which is listed here, walks through each option in more depth. And there have also been 3 webinars that specifically discuss STRMU CARES Act programs that you can download and review. We know absolutely that programs run into specific situations where staff have questions about the best way to proceed with some STRMU cases. So we encourage you to submit those client or case scenarios through the HOPWA AAQ for answers and brief TA. It's, no matter what the rules say, sometimes on the ground and in reality, you run into situations where it's just hard to come up with an answer. So we do have help available to you as it's needed. Also, we want to point out and make sure that you remember that if clients have not been making rent payments due to an eviction moratorium, that's a real area for concern and for case management intervention, because many clients really don't understand the concept of the moratorium and the fact that they will still owe that back rent and be subject to possible eviction after the moratorium ends. So working on bringing people up to date on rent through STRMU or through other HUD rental assistance or through the ERA emergency rental assistance program through the Treasury Department is very important. So another element, TBRA, as well as other permanent housing activities through HOPWA are also important resources, but really have to be approached very carefully. Programs can utilize CARES Act funds to strategically add housing units, or they can use the funds to cover increased cost of the rental subsidies that result from household income losses or increased rents in the communities and other similar circumstances. So care should be taken not to increase rental subsidy rolls to the extent that subsidies cannot be continued when the CARES Act funding is no longer available. So that's something that you have to weigh locally. We encourage you again to make use of these resources, which address how to conduct virtual remote inspections and recertifications when serving people through TBRA and other permanent housing. Another element is hotel motel vouchers. It's been an important resource for HOPWA and through many other programs as well. The expansion and flexibility of these vouchers is allowing grantees and project sponsors to quickly access emergency housing and to help quarantine family members when that's something that's needed. There are extra flexibilities that can be used under certain circumstances, as Christine pointed out, such as paying for damage deposits and paying for damages and other similar options when using HOPWA CARES Act funds And you can access much more information on that through the links that are provided here. Permanent housing placement, we're sort of the stepchild of all of these activities. It kind of gets lost in discussions like this about how to keep households in their current units. However, we anticipate, and I know some communities have already seen, that as time goes on in some areas, you'll start to see more evictions and loss of housing, making PHP a really important tool, as it always has been, but especially at this time in rehousing people in new and permanent units. HOPWA supportive services have provided programs with a flexible and often quite expanded array of program responses to COVID-related challenges for HOPWA eligible households, including all of those listed here, which Christine talked about earlier. But I think HUD has given a lot more flexibility in being able to do things like use cards for gas and food, really reaching out with education about COVID, disinfecting supplies, PPE, and so forth, as well as doing things like loaning phones or providing phone minutes or internet connection under certain circumstances to people. That has really been the mainstay and that wraps around the housing and helps ensure the housing stability of people that we're serving. And these are some of the resources that will provide more information on each of these. And many of the webinars that we've done in the past were Q&A webinars that will give you some specific scenarios and situations that may be helpful to you locally. So we want to talk a little bit about the response at this point. This is different in a lot of ways than where we started in the very beginning. With COVID-19 rates evolving and surging, and with the emergence of new and dangerous variants, HOPWA programs really should plan and prepare for the coming months. As much as we can. I mean, no one really knew that this would go on as long as it has, and it goes down and it goes up and it goes down and goes up. So as grantees and project sponsors are rolling out HOPWA-CARES Act funding housing assistance, they should be aware, should be aware of the spikes and changes in the virus's impact, and that can cause greater or renewed housing crises among people living with HIV and their families. HOPWA programs really must ensure that they're implementing housing and service responses designed to get and keep households stably housed and safe. So we're going to briefly walk through some of the key recommendations for programs as they look at client support and care priorities, including those listed here. And you can also find this information in more depth in the, if you download the document shown here called Responding to COVID-19 Surges, which was specific to HOPWA. So as the pandemic continues and more we expect more HOPWA households may experience reduced income and inability to pay for rent, mortgage, and utilities, in addition to other needs. Programs should put even more emphasis on assessing the needs and providing all possible resources to help households avoid housing instability and eviction. Housing security really must be the top priority. So how do you do that? What some of our suggestions include, do your assessments, your client household assessments more frequently. The impact of the pandemic really calls for more frequent contact about their financial status, ability to pay bills, obtain food, and all of those things. Targeting STRMU to households that are at risk of eviction or foreclosure. This may be for homeowners, one of the only resources available. So that's something important to consider. Using hotel motel vouchers for emergency housing when needed. As we mentioned, those can be used for quarantine, excuse me, but also for short-term housing, and can help make sure that HOPWA households don't end up homeless or in shelters. And if you don't have vouchers as part of your HOPWA funding, definitely look to your ESG and other providers in the community for help, because there are many programs that do have funding for hotel motel assistance. Also accessing emergency rental assistance through ESG, CV, CDBG, CV, and Ryan White. When the need is high or something that you can't pay for, coordinate closely with other programs in your area. If budgets allow, certainly adding people to households to TBRA or master leasing is something that you can do. Also, making sure that you are quickly processing any recertifications when clients have income losses, those interim recertifications, so that their rent portion can be adjusted as quickly as possible, and using PHP for placement in new housing when needed. We talked a lot in previous webinars about the importance of client outreach and engagement, and really connecting with clients at this point is especially important. We want to make sure that potential financial and social issues are caught as early as possible. So these are some recommendations. Make sure that you're using those remote methods to engage clients on a regular basis. Check in with them about their housing, finances, food access, ability to reach medical appointments, ability to pay for their regular bills, and really generally on their emotional well-being. You can adapt. There's a wellness checklist that we've included a link to here. Include that in your outreach. It's a useful tool to be able to kind of pick through what's really going on with folks. And finally, we think it's really important to reach out to clients who don't regularly interact with the program. Those are the folks that can really fall between the cracks if you don't know what's going on. So that outreach is just doubly, triply important. Like all of us, our clients need updated information on infection risks and COVID transmission. So that's another area where we may need some education and also help. And folks may need help in maintaining supplies like PPE that, maybe we're giving out more in the beginning, and disinfectants and things like that that are still needed. There are lots of good examples. I think most of you know on how COVID-19 guidance changes just based on CDC and public health guidance over the last few months. There have been lots of changes in recommendations about the need to mask even if you're vaccinated. There was double masking at one point. The very serious risk for people who are not vaccinated, and incidents of reinfection and danger of the Delta variant and all of those things. So remember that these are eligible expenses, and as outlined in the links that are provided here. Okay, so vaccinations also are very important. There have been a variety of pushes for vaccinations there, but part of your job really in working with HOPWA households will be getting information out to people as it develops, and talking with clients about the importance of vaccines, and possibly facilitating getting people to vaccination sites. it's normal to have to expect some vaccine hesitancy. And so, we encourage you to make use of the resources that are here, that are on the HUD Exchange and HUD.gov about how to work with people related to vaccinations.
So, where are we now? We wanted to give you an update on our response to the COVID planning in 2021. So as Crystal mentioned, the COVID-19 situation is changing rapidly. And as a result, our HOPWA programs must make those adjustments based on the local factors and what's going on in their communities. So one of the things we really want to emphasize is how people must remain up to date on their local COVID changes. What are the local policies around vaccines and where you can and can't be, whether if you are vaccinated? What are some of the local threats? What are the prevalence rates? What's happening with the Delta variant in your community? And what you may want to be sharing with your clients as to how they can maintain their safety or keep safe through this ever-changing situations. I think grantees should reassess the status of their COVID and their threat to the HOPWA eligible households and ensure that both information and services are reaching all sectors of the HIV community, and reset HOPWA-CARES funding priorities if that's what's needed to make sure we're being as responsive as possible. We also need to make sure this one-time funding is being spent effectively and efficiently. We also need to make sure that as we are doing this work, that it's being done in a way that is equitable across our community. There's been a lot of talk about equity in providing these services, and we also want to make sure that people have the strategies in place so that services can be done in an equitable way. We could do a whole webinar on race equity and how to provide services in an equitable way, but there are resources available out there, and please feel free to ask questions and connect with us as TA providers. Should you want some assistance in really moving forward and ensuring that you're doing things in an equitable way.
Do you have any particular tips, Christine, on how people can make sure that information is getting out in an equitable way and making sure that they are connecting with, more than just people who are looking at their website?
Absolutely. So some key tips are that you talk directly to your people as much as possible. So building on what Crystal was talking about earlier, direct contact, be it phone, text, or where possible in person, where safe in person, but that direct communication with people in your community and finding out from them, not making assumptions that but finding out from them what their needs are. One of the things that we know is that personal connection can reduce vaccination hesitancy, for instance, being able to understand where people are coming from, what their concerns are, and helping them strategize on how they can address some of those concerns in their community, where they can get some of that information. We know that telling people what to do doesn't help, but helping them understand the benefits of being able to keep themselves and their families safe actually increases their response to their concerns, and understanding culturally what resonates for them. So that direct communication, having a little bit of cultural humility and not assuming that we understand their current concerns, their cultural concerns, where they're getting information, and how we can ensure that where they're getting information is actually accurate information so that they can feel more comfortable in moving forward and addressing the concerns for themselves, their family, and their community. So really looking at what are some of the current local health and safety recommendations and how that information can be shared in a way that people will be receptive to. what's our approach to sharing this information? Some of the traditional strategies that we've been employing, we know we may have to revise or review and apply in a different way to make sure that we're actually resonating with the communities that need to have this information. Have the priority housing needs for HOPWA changed? Have we, where at the beginning, we may have been really concerned about isolation and separation because of the high spread of COVID and how sick people were getting. Have some of those needs changed to be more long-term sustainable as we move out of crisis mode, because you can only stay in crisis mode for so long? We're a year and a half into this epidemic. So what are some of the different housing needs? Have they changed? Have they shifted? And do we need to shift our funds to meet those changing priorities? And how are we spending our funding? Are we spending it at the needed pace? We know that there have been some roadblocks. We know that a lot of resources have come into communities, and there has been a tendency to try to spend them sequentially as opposed to concurrently. And we need to look at how we're doing this in a comprehensive way, given the needs of our community.
Yeah, I think that what we're suggesting is this is a good time to sit down and look at where you are right now. Where you are in terms of spending, where your community is in terms of the need. And if you are spent most of your funds down, this may be a time to pivot and really look at what other resources you could leverage in the community for HOPWA eligible households. You know, are there budget revisions that are needed? Getting that kind of input from your project sponsors as well, who are there on the ground, any input that you can get directly from clients, all of those things can be part of a planning reset for programs. And there are definitely, some budget considerations. Those budget changes that may be needed for anybody who has designated in their annual action plan money for pandemic response. Make sure that you've actually spent down, or understand that you have to spend down all the CARES Act funding before you can use that. All of those things are really important. And I think really one of the bottom line things here is spend your money and make sure that there are no delays in getting services to people who need them with this one-time money, and using some of your other streams of funding as well. There's kind of this chart will show you there's kind of good news, bad news. The good news is that contracts that virtually all of the contracts have been completed between the grantees and HUD, and 82% of the grantees have made at least their first drawdown of funds. But on the we're not so sure this is great side is that a very small percentage across the board of both formula and competitive funds, CARES Act funds, have been dispersed so far. And only 7 total grantees have spent 100% of their CARES Act funds right now, just to give you kind of an idea. And so, it's important to look at why that's happening. And if grantees are having difficulty of any kind in their IDIS setup or their ability to draw down funds, there is TA available to you. Just letting us know through the AAQ or through your desk officer, or if you're working with one of the TA firms through some of the CV outreach, make sure that people know that you need help with that, and we'll make sure that you get that. Again, there's answers and assistance are available through the Ask a Question HOPWA desk and on the HUD Exchange. You can also ask for technical assistance in helping you with anything that you need assistance with. Also, just make sure you stay informed. There are regular updates on HOPWA guidance and resources that are available in two different areas in particular. One is on the HUD Exchange and all of the COVID related information, and the other is on HUD.gov. So make sure that you're signed up in both of those places for notification about new resources and information. And at this point, I am going to give this over to Kate and Emily to see if we have questions coming in, and our OHH folks will be helping answer questions as well.
Hi, yes, we have a few questions. One of the questions was, when will you start requiring wet signatures again? And by that, the person means clients meeting with case managers, face-to-face signing documents. They say during COVID and the restrictions placed on face-to-face meetings, they were unable to obtain signatures. And they wanted to know when the deadline to start obtaining signatures was, and do they need to get back on track with that?
I think Amy and Rita may be able to speak to this as well, but I think when we've talked about this before, we've pointed out that wet signatures are maybe a local requirement, but not a HUD one. And so there would not be a specific date from the point of view of the HOPWA program. Is that correct, Amy?
Yes, that was exactly what I was thinking.
So, if it is simply a local requirement, that is something that either the locality can rethink whether that's going to be required, whether you would have to go back and obtain wet signatures, and how you're going to do that going forward. Because I would assume that in most areas they're considering things like that, because even though more areas had been opening up and people felt more comfortable about going out and or meetings in person, a lot of that is reversing itself on a daily or weekly basis, depending on where you are.
Thank you. Emily, did we have another question?
We have several questions. One question that we have been getting a couple of times is, how long do we have to spend our funds?
I can answer that. So the all HOPWA grants, including the funds received under the CARES Act 3-year awards. So it's 3 years from the signing of the grant agreement.
Thank you. And then someone asked us, is there an existing model for assessing the shifting needs in our community? Is there any way that, is there something in stock that we can hand them?
So there are some tools for needs assessments that can be adapted for really determining where you are and what the current needs are. When you think about how you were doing needs assessments in your community, you can adapt some of those tools specifically to look at how COVID has been impacting those. If that is something that you would like to request TIA on, we'd be able to review your current tool and help you adapt it for your community based on what the current epidemic is looking like in your community. But where you could start is how you generally do your community needs assessment every year.
Thanks, Christine.
Thanks, Christine. We have another question. It looks like we're going to be finishing our CV grant soon, but we are seeing a surge in our COVID cases in our community. Can we expect another round of HOPWA funds, same way ESG has issued another round? If not, can we amend our FY20 action plan to designate some regular formula funds for COVID response?
I can start answering this. We've heard this question quite a bit, and I think there's been some confusion because the ESG funds, I believe, came with different tranches or different rounds of funding in the CARES Act. And then, of course, there's been additional appropriations to mitigate the impacts of COVID-19. HOPWA has not been part of any of those. So HOPWA received that one-time initial 65 million that we're talking about today. Yes, there's a surge in many communities, but we have not heard anything about additional HOPWA funds for that. I would just say that, and we will talk about this more, I'm sure, throughout the conference, but to the extent it's possible, coordinate with those other pots of funding. There are some deeper pockets out there. HOPWA is sort of a bridge to some of those, if you can use it in that way. So if you're not familiar with what's happening with ESG or home, for example, or the funds that went to the Treasury for rental assistance, hopefully you can get some of that information here and use those funds to fill any gaps.
Thanks, Rita.
We do have a couple more questions. Let's see. Loaning our clients tablets has been really helpful in client retention. Can we continue this policy even after our CV funds are gone? Can we spend regular funds on this activity?
Good question.
Well, previously, I believe there had been guidance that equated it to phone purchases. And that was guidance that was provided in the Get the Facts HOPWA supportive services. And it requires that the tablets are owned by the project sponsor. And it would be charged to the supportive services line. Is there any movement on that, folks at OHH?
No, not currently, but this is definitely something that, we'll keep talking about and we'll provide further guidance as we have it.
Thank
Right.
you.
And I think that there are going to be quite a few questions like that about how do we make this switch back and away from CARES Act funding, but maybe retain some of the possible flexibilities that were there, and
Right.
those are things for definitely for some future guidance.
Yeah, and I mean, I think we've learned so much through COVID and some of the flexibilities that were allowed, and we will definitely be, looking at the HOPWA program, how the sort of guidance and policies that we've had just administering regular HOPWA, and see how some of the flexibilities that were allowed under COVID could possibly be worked into the regular HOPWA funds. But we will definitely keep you all posted as some of those policy decisions are made.
Great, thank you. And we are right at 9:30, Kate. And so I think that we're going to wrap this up and thank everyone for taking this time to walk through a lot of things that you've probably heard before. Make sure that you do, you can get a PDF copy of this presentation. It should be listed on the conference site. And if you have any trouble finding it at all, just let us know and we'll make sure that it gets out to everybody. So thank you and enjoy the rest of the conference.